Meanwhile, I kindly request all our joinees to uh, follow the requests on the screen shared. So please keep your microphones muted. That way, we'll all be able to listen to the conversation better, and the same session hopefully will be shared with you all after the recording. And we'll definitely be getting to the question and answer session towards the end. There's a specific segment kept for this. And so during that time, you can just raise your hand. You can use the raise your hand feature. And during that time, you can also drop all the questions you have in the chat box. And we assure you we'll try to address all of them. So kindly keep yourself on mute. So make yourself comfortable. Keep a bottle of water next to you, your notepads, your pens. And the session will commence in a couple of more minutes. We're waiting for other patients to also join in.
Good evening, everyone.
Good evening.
Good evening, Doctor.
Hi, good evening.
Yes. So, yes, I would once again request all of you all to keep yourselves muted throughout the session, and except for the speaker and moderator. If any doubts, everything will be addressed in the end of the session. So, let's begin today. Good evening, everyone. Thank you, Achis, for once again telling the guidelines and welcoming us for this event. I would like to begin without any further ado start by welcoming our esteemed speaker, Dr. B.G. Dharmanand, to the first out of the four-part webinar series this month. Lupus Trust India is organizing, the Karnataka chapter is organizing a four-part webinar series as a part of Lupus Awareness Month in May. Lupus Trust India is a public charitable organization founded in 2018 by lupus patients from Kerala and supported by individuals from all over India. The trust is committed to helping financially disadvantaged patients, particularly those below the poverty line, by facilitating access to affordable treatment and rehabilitation. In addition to medical assistance, the trust also provides psychological, uh, emotional, and social support to those affected. Its core mission is to raise awareness about lupus, offer guidance on medication and lifestyle management, and to ensure that no patient faces this rare disease alone. So, as we know, this year's theme for Lupus Month is lupus treatments, new drugs, and innovations. Are we getting any closer to a cure? Our campaign has already begun with a series of informative posts across our social media platforms and active patient support groups. It is now my great pleasure to welcome our esteemed guest speaker for the evening, Dr. B.G. Dharmanand, one of the most respected rheumatologists in India. Dr. Dharmanand is a consultant rheumatologist at Manipal Hospital, Millers Road, Bangalore, and is also the immediate past president of the Indian Rheumatology Association. His areas of expertise include chronic pain, reproductive immunology, autoimmunity, and bedside teaching. With over 30 years of experience in clinical rheumatology, Dr. Dharmanand has trained numerous successful practitioners, treated thousands of patients successfully, and has been an unwavering source of inspiration to all. He has always been a strong advocate for patients, generously contributing to awareness efforts such as this today. In addition to clinical practice, he's also an accomplished researcher and has co-authored several medical publications. On a personal note, it is because of his guidance and support that I stand here today deeply motivated and passionate about this cause. Thank you, Doctor, for taking time out of your packed schedule to be with us this evening. Shall we begin?
Yes.
Yes. So in the section 1, we will start with basic terms. There are many new patients who have joined recently in our support group, and there are many being diagnosed as such, but it's always certain terms are very foreign to them. So could you just explain to us who is a rheumatologist and when should a patient approach a rheumatologist?
It's a very, very relevant question because rheumatology is one of the most recent specialties to have a course or a training program in India. So the rheumatologist, the terminology is not in the popular vernacular of many of our common people because they are all familiar with physicians, pediatricians, orthopedic surgeons, neurologists, but rheumatology is a new name. Basically, rheumatologists are not surgeons. They are physicians. Basically, they have a training in internal medicine, followed by training in rheumatology and clinical immunology for 2 to 3 years, and they get qualified to become a rheumatologist. And what do they treat? They generally treat patients with multi-system autoimmune diseases, joint pains, arthritis. We also call it as a non-arthritic musculoskeletal disorders and osteoporosis. Who should try to see a rheumatologist? Generally, patients are referred to rheumatologist by other clinicians, like physicians, general practitioners, when they come across a multi-system autoimmune disease or an arthritis, which requires further evaluation and expert diagnosis, they are referred. And many times in India, patients are also referred by other patients. And because once you become a patient with the disease, you know about the disease, and you see somebody similar to your illness, then if they are not on the right track, then generally patients in our India, they are usually very concerned about other people and refer. I have had patients referred to me from say, Kerala by somebody who was traveling in the train together. And they said, you have arthritis? Okay. Have you seen a rheumatologist? No. And then they have asked them to see a rheumatologist. So sometimes our Indian natural inquisitiveness sometimes helps people to find the right kind of a clinician.
Definitely, doctor. I know it's improving. I think the approach to a rheumatologist when compared to a few years ago is much more. The accessibility and the awareness of the people, apart from the doctors itself, even the patients, if they have certain type of symptoms, they do approach a rheumatologist sooner nowadays, is what we have noticed. The next question would be, what is SLE? A brief overview of what it is.
SLE is also, if you expand SLE, it is called systemic lupus erythematosus. Systemic is a word to be underlined because it is not only skin deep, it affects multiple organs in the body, and it can affect any system in the body. And lupus erythematosus is a typical terminology which has come from one of the 200-year-old descriptions on lupus skin disease. So people who have only skin disease are lupus erythematosus. When they have systemic disease, they call systemic lupus erythematosus. And the short form is SLE. And it is also known as lupus in common usage. It is a multi-system. Multi-system means it can involve more than one organ system. It can be skin, eye, joints, kidneys, brain, etc. It's an autoimmune disease. Autoimmune disease means body's immune system somehow it has got actually a property of recognizing self as self and not react against our own body's cells. When this mechanism goes wrong somewhere, it starts attacking our own body system. And that these kind of diseases are called autoimmune diseases. And this is not a single disease. It can vary from very simple skin disease only to a multi-organ, multi-system, life-threatening disease. So it is a cluster. There are a lot of clusters. Some people have only joint problems. Some people have skin and joint. Some people have say, fever and kidney involvement. So multiple small clusters are there, but they are all unified into a common name called lupus. Again, lupus is not a we all feel that it is not a single disease, it is a cluster of diseases. And what causes lupus is still a mystery, and it is a disease of young women. And genes play a role. The genes and gender, they have contribute to the development. And when they interplay with the environment can vary from the time when we were in our mom's womb to the day before a patient gets a disease. So, not day before, weeks before, or months before the patient actually gets diagnosed or gets a first symptom of lupus. So, environment can be from childhood onwards, exposure to infections, toxins, environmental pollution, stress, both physical and mental stress, all can contribute to the development of lupus. So this is a very long answer for your question. So it's the answer itself denotes that this disease is a complex illness.
Yes. Thank you, doctor. Thank you for giving us a brief overview of that. And there are often patients or during the process of diagnosis, the caregivers often have this guilt that did I cause it or did I do this? So this gives us a clarity that it is not just one factor that leads to the disease. It's a multifactorial whole system that leads you to have or develop this condition as such. Coming to the next set of questions, many patients did have questions related to medications versus flare. So, what are the common drugs which are used for a patient with lupus, and what are the common side effects due to the drugs that a patient would face on a regular basis?
So lupus, unfortunately, most of the patients would require medications. The commonly used medications are hydroxychloroquine, which is a originally an anti-malarial, but when they were using these drugs for malaria prophylaxis in tropical countries, and smart clinicians have observed that many of the patients' skin lesions improve, joint pains improve. So that is how it became an anti-rheumatic drug. It is also used in rheumatoid arthritis, and it is one of the main drugs used in all patients with systemic lupus erythematosus or SLE. The next important drug which is used is a most dreaded drug in the pharmacopoeia is steroid. So steroid is always mirrored by myths and fear. But steroid is a friend for patients who have lupus.
Rheumatologist.
Sorry. Okay. And steroid is a friend, and steroid is used nowadays very, very diligently, and it is given for the shortest period of time. And most of the international guidelines are the bodies which tell the doctors how to treat the patients, how to give them the general guidelines, generally recognize the importance of steroid and also recognize these potential hazards of steroid. So it is important to give steroid as very little as possible and as short time as possible so that they get the benefit of the disease, but they don't suffer from the side effects of the steroids. Apart from that, other group of drugs which we use are immunomodulators. Immunomodulators are drugs which act like steroids but don't have the side effects of steroids. So we use it to reduce the amount of steroid we use. So we use a drug which can control the kidney disease or a brain disease or a skin disease so that I can use less and less steroids. And the last category of drugs are called biologicals. Biologicals are drugs which are produced by biological means, and they are not tablets. Generally, they act against a cell in the body, like a B cell, and are cytokine. Cytokine is a chemical produced by the immune system. So we can block the cytokine and thereby reduce the symptoms. So most of the immune system manifestations are driven by immune cells and also the chemicals secreted by the immune cells. So if you target either the cell or the chemicals produced by the cells, we can control the disease activity and we can prevent damage. Side effects I've already alluded to. The commonest side effect with hydroxychloroquine is a little bit of skin darkening. So this is the most important cause. It can of major concern in younger people who definitely value their appearance, and suddenly change in appearance can be very devastating. Apart from that, some people get rashes, and if it has to be used for more than 5 years, and it can cause pigmentation in the inner eye layer, and which needs to be monitored. If it is not monitored, it can cause visual disturbance. Steroid side effect is very well known. People do gain weight, and if you have a tendency to develop diabetes, hypertension, it can promote it, and it can also weaken the bones, and it can also cause something called avascular necrosis of the bones. And not everybody gets it. A small percentage of patients do get it, but the most common dreaded side effect is weight gain, and also hirsutism, where people grow hair where they don't want to. So if a young woman develops facial hair, this could be very distressing. And change in the body image. If somebody puts on weight where they don't want to have a fat, it can be a major problem. That is the reason it is used as short term as possible nowadays. And side effects of the other immunomodulators are generally related to immunosuppression. And we need to be watchful about low WBC counts. Sometimes some of them affect the liver. So we need to monitor. Most of the patients who take these drugs tolerate it very well. About 5 to 10% of the people can develop side effects. It is the doctor's duty to monitor it. And if they have any side effects, they will change the drug or do appropriate reduction of the dose so that the patient can get the benefit without getting the side effects.
Thank you, doctor. That was an elaborate and informative answer to your question. Going on to the next question, which kind of overlaps with this. So, there are side effects, and then there is also symptoms that we notice in a flare. For example, one of the common side effects that is encountered is gastritis. It could also be seen in a flare-up as gastric inflammation. So, how do the patients differentiate it from a side effect or flare, or what should be like? What are the danger signs which could indicate that it is a flare rather than a side effect? So, how do we go about this tricky situation?
Yeah. So it can be difficult both for patients to recognize whether they have a problem because of the drug or is the disease playing up. But there are some clues, like if usually drug-related side effects are like one skin rashes, and it is related to drug usage in time. Like if you started it on the first of this month, if you develop a rash within a week, then we can relate it to the drug. Or you are on the drug, but you have gone to the beach and you develop a severe sensitivity, then probably it is more likely to be disease related. And also, if there are other disease related symptoms in the patient, and when the patient have like a headache, they also have a rash, they also have mouth ulcers, they have a significant hair fall, then that is likely to be due to the disease. It is difficult. We have to keep looking for a clues, and the sometimes the clues can be veiled and not easily visible. So it is a duty of our doctors to keep looking for a clue to differentiate whether the problem is due to the disease or due to the drug, because the treatment can be totally different.
Yes, doctor. Understood. So it is, in summary, it is something like it's not an isolated thing that we need to look into. If it is pointing more towards a disease, there will be other signs of the flare also, just apart from the drug and the temporal relationship with the drug starting and the side effects. Got it. All right. Coming on to a very commonly asked question, and also I have been a culprit of this too. If I miss a dose, or if I happen to miss a dose, how do we go about the next dose? Or is it okay if I miss a dose? Some patients start panicking, oh no, I didn't take my medicines, my disease will turn up. So, in such a situation, how do we go about missing doses and further medication?
So this is an important question because drugs work only if you take it, and compliance is very, very important for the disease to get controlled. But having said that, we are all human beings. If somebody says that, doctor, in my 15 years, I've never missed a single dose, then I have a doubt whether this is a person in front of me or is it a robot, right? We are all human beings. We are all frail human beings. We are entitled to miss once in a while. So if you miss a morning dose, you have forgotten to take the morning, it is okay to take it in the afternoon. Though the doctor has asked you to take it in the morning, you can take it in the afternoon. If you have totally forgotten today, it's okay. Next day onwards, you can be more compliant. Never double the dose, because double the dose can be problematic. And that's all I think. You don't worry too much about if you miss a single dose, but make sure that you don't miss it on a long-term basis. Have a system to remind you. Nowadays mobiles are very handy. You can always have a reminder in your mobiles, and there is always somebody at home, mom, or a spouse, or a friend. You can use them to once in a while to remind you whether are you regular with the medications. That would help. That would help.
Yes,
But
doctor.
lose sleep over one single missed dose. That's okay.
Yes, doctor. I mean, I remember shifting into a box which had the days organizer, timing organizer, and putting the pills into that. So I'm double sure that I've taken the medication at the
Yeah,
right
but
time.
one day you may forget to take when you are going out, you may forget to take the box itself. So these are all the kind of things happen. So always carry a prescription with you. So suddenly you realize that you are ended up in Bombay. You forgot to bring your medicine. You can always buy the medicines in a medical shop in Mumbai and take the medications. But if you are going to stay in Mumbai for more than few days, right? You are going to come back in the night, it's okay. But if you are going to stay, you can always carry a prescription, either a physical copy or a photocopy with you so that you can buy the drugs.
Definitely, doctor. So I think you've also addressed the fact briefly about how it is tough to maintain compliance. Many of our patients also face habit fatigue. And I have seen so many of my loopy friends also who have been confident that they are in remission and they don't need the drugs anymore because they're tired of taking the drugs. The monetary benefits, I mean, the money is difficult to arrange for, and they just give it up. So, how do we deal with one, low motivation, and two, the habit fatigue that comes with a routine, especially in drugs, with respect to drugs?
This habit fatigue can be very real, particularly when you are doing well. When you are still having a joint pains or if you have a rash, the rashes and joint pains will remind you to take the medications. When you are doing well, you are on maintenance mode. So you would look normal, you will feel normal, and then you can forget. So it is a real problem. So we need to overcome by educating ourselves to the need. So what will happen if I stop? If I stop, if the disease comes back, it can become nastier than what it was, and you may require more medications. So this knowledge will prompt us to be little more regular and beat the fatigue. And also we can keep some, as I told you, you can keep some reminders so that you are reminded to take the medicines, and also involve your caregiver like parents, spouse, friends. So they also will reinforce that the need to take medication. So always involve them in your care, whoever you have a trust, and this is important for them to be a part of your journey so that they can help you. It's difficult. It's difficult. Once in a while we'll flip, we'll learn, and then again next time you will be a little more strict. And whenever you go to the doctors also ask whether you are taking the medicines. Many times we are scared of doctors, and we tell that, okay, okay, doctor, we are taking. So we have had patients who were not taking medicine, not because of habit forming, but due to various reasons. People are scared of steroids. People are scared of getting obese with steroids. And people, obviously, they buy the drug and hide it somewhere. And parents don't know. When they come to us, they are not doing well. So we have to break our head every time, give a new drug, but only to find that they have not been taking the medicine for the last 6 months. So it can be a problem, particularly in a youngster who are generally like the rebellious character is inbuilt in adolescence. All of us were rebellious. We didn't want to listen to everybody, and we don't want to follow the norm. People hate going to the hospital. So in that scenario, it is easy to drift into non-compliance, and the education and involvement of the society and friends is very important.
Thank you very much, doctor. Coming on to the last question in this section. As we know that many of us do travel often in terms of work or just a normal travel to workplace, morning to evening, this something that I do practice and carry is my emergency medicine kit. Some sort of medications that I need to keep with myself at all given time. So, if you were to suggest what should be the medications, basic ones to keep with yourself as a patient in terms of a regular routine travel or long-term travel, that would be good because this was also one of the questions that is commonly asked.
And people should carry their prescribed medication. That is the most important thing. So if they have their prescribed medications, most of the time things are taken care. And one important thing I would recommend everybody to carry is, particularly when you are going for a trip or a travel, or you might go out in sun, don't forget to carry a sunscreen and carry maybe a hat or pack some long sleeved dress. So the sunscreen is a very, very important protective tool, because the sun induced damage is like a booster for the immune system to attack ourselves, because the sun in a sensitive individual causes sunburn or a sun damage. The damaged cells leach out their DNAs and other materials, and they get exposed to the immune system, and they produce more and more immune complexes and can cause a flare to the disease. So a severe sun exposure and exposure induced damage can act as a booster for the disease. So we have to be very careful. Apart from that, like a commonly used drug, some paracetamol is always a safe pain medicines. And what else? And carry a steroid, even if you have come out of steroid, maybe a pack of steroid, maybe 10, 15 tablets of steroid, like a prednisolone or methylprednisolone, 1 or 2 sheets. Suddenly you get a joint pain, you can manage it with one or two tablets of prednisolone until you come back and reach your doctors. So steroid pack could be useful. I won't advise you to carry antibiotics and other stuff because most of the infections we get is viral and they don't require antibiotics. So unnecessarily we start taking antibiotics and damage our gut bacteria, which can have actually a negative impact on the immune system and probably lupus. Another simple drug which you should carry is an antihistamine, like Avil or allergy tablets. Sometimes we get itching or rashes. You not go to a doctor, you can take on Allegra or Avil and manage. So these are the things we should carry apart from your prescribed drugs. They are the most important drugs.
Yes, doctor, definitely. Thank you so much for that answering that question. So, in summary, with respect to medication versus flare, we need to make sure that we watch out the side effects versus the lupus flare symptoms as such, and we should always keep an emergency kit with us. And compliance is very important, and be truthful to your consultant regarding the same, so we can modify the treatment course accordingly. So, moving on to the next section, being the role of a support system, which is very much a lot of questions are based off on this. As to one common one is, for a newly diagnosed person, what would you recommend? How do we go about the acceptance of this condition? And in terms of the patient themselves and the immediate caregivers who are there on that day when you explain the diagnosis to them.
This question is very, very relevant, and it is also the most difficult one to answer because we are on the other side of the table. So explaining a difficult disease to the patient is very stressful for the doctor himself. If a 17-year-old medical student sitting in front of me, I have to say that you have a lupus. And that can be very difficult for us. And for the patient, it is definitely much more difficult to accept it because it is totally a strange terminology for them when we say you have systemic lupus erythematosus or SLE, because until that date, they have not heard about this disease from anywhere. Nobody in the family had a similar disease. So all these things can cause a significant distress to the patients, and mobile with the current advent of Googling can make them really, really afraid because there's a lot of information. There's no doubt about it, but you always catch the worst possible news from or information from the Google, and that can be very dreadful. And even if in good old days, people used to talk to their family doctors and other friends who are doctors. So they all can sometimes give a very scary message. Oh, you have a lupus, it's such a scary, very difficult disease. It can be a life-threatening disease, etc. So this can be a very difficult phase for the patient and also the caregivers to accept. So everybody goes through the shock period and a brief period of getting upset. Then acceptance phase comes. Earlier it comes, it is better. How is there any way to make it come earlier is difficult. Each individual has got their own coping mechanisms, and also it is factored in by the social aspects. Your parents are, if they're too vigilant, that can affect our response to the illness. If they seem to be crying all the time, then you think that they're having some serious disease. So this is important, and a good discussion with your clinician. And if you are not convinced about the diagnosis, nothing wrong in seeing another clinician to confirm your diagnosis. And of course, there is always a patient support group. If you meet somebody else who have a similar problem, if they know that you know that they have dealt with it in the long run, 5, 10 years they are living with it, that gives you the confidence. So that's the importance of support group like what you have. And still, if you are not able to manage it, it is nothing wrong in taking the help of a mental health professionals like clinical psychologists. Sometimes accepting a disease can be very, very difficult for some people.
Thank you very much, Doctor. I think the fact that you gave us multiple approaches to acceptance was lovely. Coming to the next question, many patients are adults, right? So they have this notion that for their regular follow-up, it's okay for them to come alone or go alone. They're independent people and things like that. But sometimes this question of is it necessary to bring along a caregiver always? And what is the importance of having a caregiver with you when you go for follow-ups is one
Yeah,
thing.
this is an important question. See, once you are an independent adult, you know your responsibilities. Many a times you don't need a caregiver to come to you for all the visits, but it is always useful to have a trusted friend or a spouse or a parent to come for the consultations. And sometimes in our emotional state, we might not have understood what doctors have told, and you would be interpreting it in a negative way. If there is a spouse or somebody else who has come with you, no, that is not how doctor meant. He meant a different way. That can all help to get a little bit of clarity about the consultation they have had, and they can also help us to give the support, moral support for the going through the diagnosis and going through the maintenance phase. But I feel that the caregiver should not be overbearing as well. So that's a delicate balance a caregiver has to given. But nobody in our society gives a giver a course how to be a caregiver, responsible caregiver. So again, it can vary from family to family, friend to friend. But if you trust yourself, then most of the consultations you can go alone. But if you need little more, if you are not sure about your own response to the consultation, may not be a bad idea to take a close friend or a spouse or a partner, whoever it is.
Definitely, doctor. Thank you so much. On the same basis, so you do come across a varied age group of patients, right? Starting from juvenile patients to patients who are in their peak career stage, to patients who are family planning, to mothers who have children. So, to all these range of patients, spectrum of patients with their caregivers, in a very general term, what are a few do's and don'ts for the support system that you would suggest in during a consultation and during their stay at home or their primary environment?
General dose are help them to learn about the disease, and you can probably contribute by getting some education. The caregiver can get some little more information about the disease so that they can be a reinforcer of the right things to be done. And also the caregiver should, rather than spoon feeding the kid or a spouse, are taking whole responsibility, they should encourage self management skills. So they should be there in the background in case of need, in case of support. They should be offering their ears, not the mouth, not advice. Just listen to their grievances. Sometimes they are upset. They need you to listen rather than you to give them advice how to go on about their life. Sometimes that helps. So you need to be a good listener, and wherever it is asked, you can give your some opinion. And these are the few things I can think of at this moment.
Yes, doctor. Thank you very much. Because I do see a lot of patients themselves experiencing a lot of emotional difficulties because they're like, their mother-in-law told this, their uncle is telling this. There are 100 people giving out advices that you should try these, you should try this course of treatment, you should try that course of treatment. So it's a very delicate balance to finally reach that stability in terms
Yes.
of their living with respect to the whole support system and back into routine as such.
And we have to
So
we have to realize that everybody who's giving advice is well-meaning. So there we can't say they are wrong in giving the advice. They mean right, but sometimes with very negative outcomes. Because if they sometimes they do scare patients away from a treatment which is working beautifully well, because that uncle has told that no steroid. My auntie had a problem and she took steroid and died. Something like that. These are two type of words can immediately make the patient stop the disease drugs which are doing very well, and come back with a big flare which require more and more drugs.
definitely, doctor. That saying, too many cooks spoil the broth, I think it is relevant here. So, wrapping up this session of role of support system. So, as we know, the importance of one, accepting the diagnosis, taking all the help that you can to accept the diagnosis. Make sure you have a support system. Reach out to other patient support group too, so that you don't feel like you're alone in it. And a few do's and don'ts of the caregivers that you told, that listen rather than advice. So these were a few takeaways from this session. Coming to the next one, that is the importance of holistic approach. I still remember my first consultation with you when I had come, how you did not just put me on medication, but you sat me down and gave me you told me about my sleep, my diet, my routine. So what the importance of holistic approach, and we'll start off with a few commonly asked questions, in that being one of the specific ones is, are there any specific supplements or dietary changes that can help reduce inflammation in lupus? This is also a very controversial question, is what
Yeah, I
I
agree,
have
agree with you.
seen.
Very difficult to get scientific evidence for this type of support system, but only these are the things are in our hands. So we can't change our genetic susceptibility. We can't change our gender. We could not go and undo the infections you have had in the past, antibiotics you have in the past. So what is there in front of us is only lifestyle and few supplements which we can use. So as I might have told you, we have only sleep with us, diet with us, exercise and mental relaxation, and we can to a certain extent be aware of the pollutions around us, cosmetics, plastics, which can promote autoimmunity. So beyond that, we can't do anything. So we can do only what we can do. So one of the commonest and everybody should use is vitamin D, because we are also asking people not to go out in sun and use sunscreen. And low vitamin D is also associated with pro-autoimmune disease profile. So taking a little bit of vitamin D, like a 2000 units equivalent per day, and taking a multivitamin just to cover anything missing in your diet. It makes a common sense. We don't know whether it will really make a big difference to the disease, but there is evidence on vitamin D helping the lupus patients. And anti-inflammatory diet, like what is anti-inflammatory diet? Avoid processed food, avoid junk food, sweets, less salt, and more fiber. That's all. In simple words, eating more fiber, less processed food, and more natural food. So more fiber, the food has much better gut health. Much better gut health means much more protective immune system, or not an angry immune system, but calm immune system. Something called T regulatory cells become more. Generally, they quieten the immune system, and so that can help.
Okay, doctor, thank you so much for that question. One more thing is, how do stress and emotional health impact the lupus activity, and how can we manage that better?
Yeah, stress is again, see, during stress stress can be many. It can be physical stress, mental stress. So, and good stress, bad stress. Called distress, eustress. So getting a job is still a stressful, it's called eustress. So every stress has some positive and a negative connotations. So stress also causes a lot of epigenetic changes, like a lack of sleep, stress can make multiple gene to express in a different way because it changes the way gene responds to the environment. So having a stress-free life definitely helps in dealing with any disease, particularly autoimmune disease. How do we deal with the stress? That's what's important. And the easiest way is to have friends and have increase the social activities and planned social activities. You can have a like a pleasure activity scheduling. Okay, every Saturday evening I'm going to go for a like a walk or a park or have a restaurant, whatever it is, with the friends. That can help. Having a hobby definitely helps, because many times if your mind is busy with a hobby, or if you are happy with doing things which you like, many times immune system also becomes a little more quiet. And sometimes you need a help of a mental health professional like clinical psychologist. If the stress is too overbearing, that the stress is occurring from all you have a lupus and you are just going through a breakup and you are losing a job. This, if it adds up, it can be very stressful for people. Sometimes they require the help of a clinical psychologist.
Definitely, doctor. Thank you so much for that the answer. Coming to the next question that is again commonly asked, most patients, as you told, are young women or young in the younger age group where their career is being shaped or they need to make choices as to what next. I mean, I myself was had to rethink my career options after being diagnosed. So, what are a few recommendations that you would give for patients who have to make a career choice with respect to keeping lupus in mind?
Again, this is a difficult question and difficult choice for both the caregiver and the patient, because if you have the strong will, no, there is no barrier. So people can. I have my own patients who have lupus who have become police officers. People have become doctors. There are a few people who have joined the army as nurses. So it is possible. There's no real barrier, but the jobs which require constant sun exposure, lot of traveling, outdoor activities could be avoided. And if you have a lot of brain fog issues, intellectually very demanding job may be difficult for you. So these are the few things I can think about, but otherwise the disease is very well controlled. There is no job which is out of bounds.
That was very inspiring to hear. I'm sure many patients are happy to hear this and are looking forward to, exploring their passion and choosing a career. So this brings us to an end of the importance of the holistic approach, where you have spoken about the things that we have in our control to keep the disease under control. That is the sleep, eat, food, diet, routine, exercise, how to manage our emotional stress, and also giving us a brief about how anything can be achieved if done in the right way. So, coming on to the next question, which is also more relevant to the theme this year, that is the legalities and the advances so far. So, the next section involves, we have many, I think every patient who joins the support group asks this question as to what are the facilities or services available for a person who is not monetarily well off, and what is the process of insurance that they can apply for, what is covered under the insurance currently, especially in Karnataka, since we are catering to today a Karnataka specific group. Could you shed some light on it, doctor?
So no person with any disease should be denied of the medical facility. And Government of India and Government of Karnataka have what is called as a right to health. like a Right to Education, Right to Health Act. So it comes under something called Arogya Karnataka. Like they have some 2018 or somewhere they have got this.
Ayushman Bharat, doctor?
Not Ayushman Bharat, Arogya Karnataka plan. 2021, it is gazetted. So every person with disease, any disease, have a right for accessing healthcare. And government does provide, supposed to give free access to many people with the disease. This is done generally in government hospitals. Problem is government hospitals don't have enough trained rheumatologists to provide the services. So on paper, if you go to a medical college and a government hospital, you should be getting treatment free of cost. But that doesn't always translate into care. And organizations like ESI provide good healthcare for their whoever is enrolled with ESI. And it is tough for patients who particularly require more expensive therapy. We don't have an easy access to healthcare facilities where trained clinicians are available. So, but on paper, as per law, everybody has equal right for access to health, irrespective of whatever disease you have. Some of the minor diseases like thalassemia and immunodeficiency syndromes are covered by government. Government pays for their IV immunoglobulin, etc. But it is not still true for your lupus and other autoimmune diseases. But wherever the government facilities are available, they should be able to get the treatment, appropriate treatment. Regarding insurance, again, according to law, nobody should be denied of insurance. And if you go to any of the websites of the insurance companies, they say that people can, with the lupus or arthritis, can get insurance, but they may have a higher premium and there's a waiting period. So if you start insurance today, first 5 years, your lupus will not be covered. And you need to pay higher premium. So I have spoken to quite a few people with who had the insurance companies. They all see these autoimmune diseases as potentially which can give them a lot of expenses. So they generally tend to avoid giving them. So though legally you cannot be denied, but most of the insurance agents, moment they see some of the diagnoses, like rheumatological diagnosis, like lupus, arthritis, rheumatoid arthritis, it is denied. If somebody goes to consumer court and fight it out, you cannot be denied the insurance. But I had a pleasant talk with one of the CEOs of a company. He said, "Doctor, you have to wait for some time. We cannot refuse insurance to anybody. In the near future, we all will come out of insurance schemes which would help everybody with autoimmune diseases. We may charge them little more. We may give them some like a period first through to 5 years waiting period before they can avail all these things, but it will come. I think hopefully in the near future, you all should be able to avail insurance. But at this moment, it is difficult. And lot of I see patient, at least one patient a day says that I'm not able to get insurance every day. So the theory and what is practiced is still not matching. The government has a good intentions, but insurance company, it's a business for them. They are not seeing it as a viable option to give insurance to people with chronic diseases.
Definitely, doctor. This is one thing that needs more. I mean, it is good to hear that there is some hope in the near future. Many of us are looking forward to it. And keeping this in mind, also, what are the current policies that are functioning from Karnataka government or from the Indian government, which can be applied for patients of lupus? Could you shed some light on the same?
I'm not sure which is anything which can specifically apply to lupus. I think everybody has access to that Ayushman Bharat and some of the Vajpayee schemes. If you are below poverty card holder, you are eligible for many treatment. If you are employed in any organization where you are eligible to get a ESI, there the health coverage is very good. health coverage is very good. If you have a central government employee, CGHS schemes cover most of the drugs. Problem is most of the hospitals still don't have a fully trained rheumatologist, but that problem will get solved over time because from my days, only 4 rheumatologists were coming per year. Per year in India, like only 4 trained rheumatologists, 2 from Madras and 2 from Lucknow. Now there are 70 to 80 rheumatologists are coming out every year. So they are likely to find employments in multiple areas. Victoria Hospital, our Indian Rheumatology Association Karnataka chapter, we are running a weekly OPD in Victoria now. So many of us go once a week on Thursdays. We are trying, but I think it's still what should I say? Unmet needs.
I think even a drop is enough to create an ocean, doctor. So this is a start, a good hope for all patients, and looking forward to the changes in the near future. Coming to the last question of today's session, to end off on a hopeful note, what are the recent advances in medicine that we are seeing with respect to lupus? Because there are few things that keep popping up as to CAR T cell, it's going to cure your lupus completely. So coming from you, the expert himself, would be exciting and hopeful for the patients as to what are the recent advances, what are the things that we can look forward to as lupus patients.
Really exciting time in the field of lupus because of the better understanding of the immune system and autoimmune basis of the disease. Earlier treatments were like a general treatment. You know that immune system is overactive. We put a lot of sand and water to douse the fire. Now we know where the immune system is going wrong, and we are understanding more and more about the nuances, complicated interplay of immune system. So that is leading the way to newer and newer therapy. As you had alluded to, CAR T cell therapy is a big promise and a potential cure. But at this moment, it is out of reach because it would cost anywhere between 50 to 60 lakhs per patient. And it carries some amount of morbidity as well because there are a brief period. It is like you are totally immunosuppressed, vulnerable for infections. So it is not a simple, like take 10 tablets for a week and then you are cured forever. No, it is not that way. It is a very complicated procedure. But this is a first step. I think people are building on this, and hopefully in the near future, the cost will come down. If it is going to be available for 10 lakhs, a cure, it is worth then having the disease for a lifetime. So exciting time. There are new antibodies and directed therapies are also coming up. There are already quite a few are available abroad. Is still not yet available. They are not cure, but they can take care of the disease when the conventional treatment like steroids or azathioprine, mycophenolate, and other drugs which we use are not helping the patients. There can be few other biologicals which are available like a Benlysta, Anifrolumab. They're all available, and sure they will come to our country. CAR T cell therapy can be done here because it is done by people who are hematologists, and it is done commonly for leukemias. So technology is there. So they have already started doing it for cancers, and cancer people would somehow do it because it is a life-threatening disease. When it comes to an autoimmune disease, still people are little not sure whether they should send everybody there at this moment because many of them will do very well with the minimum drugs. So why do we expose them to a very potent therapy? But somebody who is sick and who is not doing well, but we have some hope. And definitely another 5-10 years, things will change. People will become more experienced in this technology and it can become cheaper.
Thank you very much, Doctor. That was very hopeful to hear. And it's interesting to see the advancements in science and how it is always progressing towards a better future. So that brings us to the end of this session, as well as the webinar in terms of interaction, the questions that we could collect from the patients. Coming in terms of legalities and advances, to summarize, as you told, that there are few insurance companies which do cover, but few are also promising better responses in the near future. And a few under ESI and under government setups, there is right to health for everyone. And hopefully, we will see a better condition in the near future for patients who are on with monetary constrictions. To conclude, Doctor, what would you say the take-home messages would be for patients of SLE and the support system?
Yeah, and in this forum, I would hesitate to call everybody who has lupus as patients. You are not lupus. You are not lupus patients. You are lovely people who happen to have a small disease called lupus. And my suggestion is, okay, lupus is a chronic disease, and you may have to many a times take medicines on a long-term basis, but there can be happiness, and happiness can coexist with lupus. And be hopeful.
Thank you very much, Doctor, for the warm take-home message. Be hopeful, be happy. Now, I would like to 5 minutes, Doctor. Any interactions, any questions that the audience has?
Yeah, you can take. There are quite a few in the chat. You
Yeah,
can take.
chat box also. I'll just look into a few. Yeah, there were 2, 3 questions as to male lupus warriors. How common is lupus in male patients? And now also we're seeing in our support group, Doctor, there has been quite a few increase in the number of patients with who are males who have lupus.
Yeah, male. I mean, we all assume that lupus is a disease of young women, but young men also get it at much lesser frequency, particularly when the onset is in the near the childhood. Like in the childhood, the ratio is almost equal. There are equal number of boys and girls who have lupus. But during after adolescence and adult age group, girls definitely outnumber boys by a significant ratio, 3, 4:1. And there is also, initially people thought the male with lupus may have a more severe disease. But one of the reasons for it being severe is they were not recognized, because most of the doctors think of lupus only in girls. And when the young boys go with the same illness, they would think of a different disease. So there could be a delay in diagnosis, which could be one of the reasons where prognosis was considered little low. I think with appropriate treatment, whether you're a boy or a girl, you should do well. And the issues, like, there are slightly different issues in men and women, when it comes to pregnancy, fertility, etc. So, but most of them are now manageable well with the medications.
Okay. All right, Doctor. Thank you so much. There have been few questions on there are few symptoms, like there's Tabu Sheikh who has mentioned that I'm suffering from RLS. Can lupus be a reason behind this? And one more person has told, can IVF cause lupus? So there has been certain associative questions. Can this be a reason to lupus, or can lupus could have been a reason to this? So how would you say to approach such things?
What was it before IVF? Something
Before
else
the
was it?
IVF, I am suffering from RLS. I think
RLS.
yes, is
RLS is
lupus.
the restless leg syndrome,
Yes.
which is not directly related to lupus. The most common cause for restless leg syndrome is iron deficiency anemia. And if you are a young girl, you are very likely that you are iron deficient. So first thing before you do anything, correct your iron deficiency. Many times the restless leg syndrome can subside. If the still doesn't subside, there are medications available, but I don't think it is directly related to lupus. It is an additional comorbidity. Then another one was IVF.
Can IVF cause lupus?
Yeah, IVF will not cause lupus, but in a patients with lupus, particularly if you have antiphospholipid antibody, the IVF can be little complicated because they use a lot of estrogen during induction. A lot of estrogen is produced, so we may have to cover this period with a blood thinner, etc. So, but IVF will not lead to lupus, and IVF happens in a young age group, younger age women, and happens to be women, and lupus also is common in women. So it just may be a coincidence. It could have been a precipitating factors. See, lupus is causation is different, precipitation factors are different. If there is a immediate death of somebody in the family, if there is a road traffic accident, if you have COVID, like that, IVF can bring out something which is smoldering underneath to bring out to come out in the surface rather than causing it.
Yes, doctor. One other common question that I've been seeing in the chat box is what is the prognosis or what is the expected lifespan of lupus patients?
It has tremendously improved. Tremendously improved. Say when I started 30 years ago, like if you have a lupus nephritis, particularly if you have a more severe form of lupus, like lupus in the kidneys, lupus in the brain, lupus in the heart, etc. Like 5-year survival rate was like 50. Before steroids, 5-year survival was only 20%, like in 50s and 60s. Now, 20-year survival is itself is more than 95%. So, we are not losing many patients with lupus nowadays, and only a small percentage of patients who present with a very severe refractory kidney disease. Sometimes they come with very severe heart disease. We are losing them. So now the prognosis has significantly changed. Most of the patients with kidney disease are either drug-induced remission. Those who unfortunately fail the drugs can be still managed with dialysis, transplant, etc. So the life expectancy has significantly risen. And as I told, I don't may not be very correct with the number, but 20-year survival is more than 90% now.
That's good, doctor. That's hopeful. One more common question that many patients asked with respect to mental health. One is fatigue and mental health, depression and anxiety. Is it connected with lupus, and can lupus cause depression or anxiety and things like that?
Yeah, it is a very important question. It can be two-way relationship. Like lupus itself can cause brain fatigue, and sometimes anxiety and depression as a part of the disease. And having a chronic disease itself can lead to a reactive depression and anxiety about your future. So it's difficult to disentangle. And but fortunately, they respond to the conventional treatment with both clinical psychology support, and sometimes medications.
Yes, doctor.
And of course, controlling the lupus also helps many times controlling the fatigue.
Fatigue
And
also.
fatigue is a complex symptoms. Fatigue can be due to multiple factors in a lupus: iron deficiency, anemia, low vitamin D, depression, anxiety, and lack of fitness. All can cause fatigue in addition to lupus itself.
Yes, yes. How to approach a flare-up post-remission is one of the other question that is asked commonly.
Yeah, in a similar way, like how we start treating during the first visit also. So depending upon which organ system has flared, so we need to give the appropriate therapy. If it is only a minor skin flare, a topical ointment may be enough. But if it is a kidney flare, then we may have to do reinduction therapy. So we may require a higher dose of steroid. Maybe change in the medications if the patient is compliant with the current medicines. Many times, flare happens when the patients don't take the medicine and compliance is poor. So if a compliance is good, this patient still flares, then we may have to change into a different modality of drugs. And we induce what is called as a remission inducing agent and try to maintain the remission with minimum drugs.
Yes, doctor. Thank you so much. One of the last question repeatedly asked by many patients is lupus and marriage. Can we get married, or is it uh, possible to get married? What are the complications as such? I mean, this is asked very often, doctor.
It is a very complex situation in India. And India, it has got a different connotations also. Like we need to have marriage counseling and a pre-marriage counseling to the parents. So parents want to know whether they can get their children with lupus married or not. So marriage is not a problem because with the current scientific medication and treatment, most of the people would do well to pursue a career and lead a near normal life. And pregnancy is definitely possible. Even if you have antiphospholipid antibodies, with the treatment, pregnancy is possible. Though all the complications of pregnancy is slightly higher, but they are all possible. So marriage is definitely not contraindicated. There are few situations which are contraindication for childbirth. Somebody has a kidney failure, somebody has got a very severely affected heart or lung disease. We generally, people who have had a blood clot and had a stroke, then we discourage them from having children, right? But marriage is different. Two individuals like each other want to live together, and as long as the other partner knows that this person has got a disease and the nature of the disease, and if it is informed, there is no contact, no problem at all. What I advise is don't hide and marry your daughter to somebody or a son to somebody. It can lead to complications. If somebody understands that his or her partner or a love interest is suffering from lupus, still wants to marry him or her, there is no problem with that. But you have to inform your doctors about your pregnancy plans. That is more important. So pregnancy has to be planned pregnancy, because any pregnancy in lupus patients will be a slightly high risk pregnancy. And you may be on certain tablets which may not be good for the baby. So this is very important, but marriage is okay. Pregnancy has to be planned.
Yes, doctor. The last question, then we'll wrap up, doctor. Are there any patients or any patient cases who have completely stopped the need for steroids?
Yes, steroid, actually the current advice is to take off the steroid as early as possible. So the timeline is difficult to say, but if somebody is getting diagnosed today, we would want them to be off steroid as early as possible. We try to start tapering from 3 months onwards, and with the aim to stop by 1 year. So most of us are stopping steroids now. So there is no, in good old days, steroid, nobody dared to stop steroids because we didn't have enough effective medications to control the disease without steroids. Now we are able to, and most of the patients are able to stop steroids.
Thank you so much, doctor, for your valuable time. I would now like Suzanne, the patient leader from Lupus Karnataka, to deliver the vote of thanks for today's session.
Yeah, thank you so much, Pri, for moderating that really wonderful session. And it is my privilege to deliver the vote of thanks on behalf of Lupus Trust India. And first and foremost, our heartfelt gratitude goes to Dr. Dharmanand for gracing us with his presence today. It's been such an honor to hear from you, such deep insights with so much clarity and compassion. And we are so grateful for all your unwavering support that you've had for the lupus community, for patient advocacy, and all the work that you've done with IRA for patients all over, Bangalore and Karnataka also, and all over the country. So thank you so much for taking your time to share your knowledge and experience. It's absolutely invaluable to us. And also, I would like to thank all the participants and attendees who have joined both from Karnataka and from different states of India. And your presence, your engagement, your questions, all of this has made this session really meaningful and relevant to everyone present here. And we hope that you have also received a lot of value from this session. And yeah, we also encourage you to continue to be part of this lupus series for the entire month. And we're also really grateful to the organizing team, the volunteers, all of put all their effort and heart into this cause and to make this series happen. So yeah, and as we move ahead, let's keep the cause alive and also be part of these sessions and encourage each other and inspire each other. So thank you so much again, Doctor. Thank you, Pri, and thank you, everyone. Have a wonderful evening. Thank you.
All the best for you all.
Thank
Doctor.